make future innovations, build on the latest treatments to offer even better outcomes for patients? I think maybe have touched on that, but maybe speak to that a little bit more as far as longer remissions.
Right. So I think right now the main emphasis in research is to take some of these really promising drugs that were developed for relapsed follicular lymphoma and do two things with them. Test them in combinations in the relapse setting to see if you can make them even more active. So an example of that would be take the drug lenalidomide, which is really active in the relapse setting, and pair it with the drug mosunetuzumab, which is very active in the relapse setting, and pair them together and see if you can get better results than either drug alone. So there are studies trying to answer questions like that at this time. And then the other area of major interest is to take these promising new treatments approved in the relapse setting and test them up front. So there are studies being literally designed right now as we speak that will test bispecific monoclonal antibodies in the frontline setting. So patients can envision being offered a chance to have a chemo-free strategy where they're just getting a bispecific monoclonal antibody as their initial treatment. And there are studies that will test these drugs as single agents, and there are studies that will test these drugs in combinations with other agents in the frontline setting, like lenalidomide, for example. So we have no results from any of these trials yet, but these trials are just starting to enroll patients, and this could fundamentally change the way we're managing follicular lymphoma in the future if any of these new strategies turn out to be more promising than what we have done historically.